Hi, does your eye doctor currently have you or your child patching for hours upon hours every single day for the treatment of lazy eye? Do you currently struggle with your child to get him or her to wear the eye patch to school or whatever because they gotta wear it for a very long period of time? Hi, my name is Dr. Benny Xiao. I am a developmental optometrist, and I just want to discuss with you today a little bit about patching. Now, patching is usually done for the treatment of lazy eye, and sometimes for the treatment of eye turns to try to get the eye that's not being used to be used. And the premise is pretty simple. It's really a very simple premise that if you have one eye which doesn't see clearly and the other eye that does, that you simply patch the good eye to try to get the bad eye to work more. Now, there's one problem with that, and the problem basically is this. The lazy eye is present because the brain has trouble utilizing the input from both eyes at the same time. So if the problem has to do with how your brain utilizes input from both eyes simultaneously, well, frankly, patching doesn't address that, because when you're patched, you're only using one eye. And if that's the case, then you really haven't addressed the problem at its root. Now, when we do patching, there is no measurement of whether or not the individual is able to see proper depth. We're not measuring how well you're able to judge distances and so forth. So we're basically not really addressing the problem in its entirety. Without addressing the underlying binocular issues, it's possible that the gains that you make through patching can actually disappear once you stop patching, because you're not addressing how the brain processes simultaneous input from both eyes. So, and one other thing to keep in mind is this, that when you patch for hours upon hours every single day, that you're not really training the eyes to actually work better. One of the things that have come out recently is that a lot of the studies that have come out say that patching with vision therapy for 20 to 30 minutes at a time is just as effective, if not more effective, than patching for a whole day. So the implications of that, of course, are that you as a parent no longer have to struggle with your child to get them to wear the patch to school and so forth. That just makes life so much easier for everyone. So I invite you to ask yourself a few questions. Are you happy with the way things are going with your current eye doctor insofar as the treatment for the lazy eye is concerned? Are you happy with the way that your child's eyesight is improving? And is your doctor currently testing to see whether your child is able to actually see 3D? Those are some things to keep in mind. If not, then I invite you to give me a call so that we can set up a time for consultation, and I'd be happy to answer any questions you may have. Thank you.